Welcome to our playlist, featuring home care aid skills training videos. These videos are designed to complement your classroom learning during the Home Care Aid 75-hour certification course and to assist you in preparing for the Washington State HCA Certification Skills Examination. Brought to you by Akasa Academy, we specialize in offering a diverse range of training programs tailored to healthcare workers and holistic health practitioners. Today, we will focus on an essential skill for all healthcare settings: assisting a client to eat. This demonstration will guide you through the correct procedures to ensure safety and hygiene. Perform beginning steps. Supplies. Gather all supplies before starting the task. Wash your hands. Introduce yourself by telling the client your name. Privacy. Provide privacy. Explain the task you are doing to the client. Scan. Ensure everything is back in place after completing the task. Supply list. 1 clothing protector, wet wipes for cleaning hands, 1 meal tray, 1 cup of water, 1 plate with food, 1 spoon and 1 fork. Napkins. Procedure steps. Ensure the client is sitting upright in a chair before assistance begins. Sit at the client's eye level to facilitate feeding. Check that the correct name is on the meal tray. Offer the client a clothing protector. Clean the client's hands with wet wipes, using one side of the wipe for one side of the hand, and then the other side for the reverse, using a new wipe for the second hand. Offer food in bite-sized pieces, alternating types of food, or asking the client's preference for each bite. Offer a beverage to the client during the meal. Ensure the client's mouth is empty before offering the next bite or sip. Engage the client in conversation throughout the meal to encourage eating. Wipe food from the client's mouth and hands as necessary, and at the end of the meal, remove the clothing protector if worn and dispose of it properly. Clear the table of leftover food. Leave the table clean, dry, and clear of food items.